Hello, everyone. Thank you all for being here and welcome to our webinar on understanding the impact of the COVID-19 pandemic and promoting health equity among children, adolescents, and families in Canada and the United States. I'm Dr. Christine Chambers, Scientific Director of CIHR's Institute of Human Development, Child and Youth Health, also known as ITSE. And we're really honored to be co-hosting this webinar today with NIH's Eunice Shriver, National Institute of Child Health and Human Development. We respectfully acknowledge that the land on which our institute is hosted is Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. As an institute with a national reach, we honor all Indigenous peoples from coast to coast to coast for their past and ongoing contributions to society. We strive for respectful partnerships with Indigenous peoples on a path towards healing, reconciliation, and self-determination. CIHR, the Canadian Institutes of Health Research, is Canada's federal funding agency for health research. And our institute is one of 13 institutes at CIHR. Our vision is better beginnings, vibrant childhoods, and empowered youth. And our mission is to foster growth and equity across Canada's human development, child and youth health research community. This collaboration that you're participating in today was sparked by a CIHR visit to NIH in November of 2019. Then, during the early stages of the pandemic, we identified a shared commitment amongst our agencies for supporting research in understanding and responding to the impact of the pandemic on the lives of children, adolescents, and families. These synergies inspired us to collaborate and host this knowledge sharing event together. Although our contexts differ, sharing ideas and lessons learned across borders is instrumental for scientific progress and for advancement. The focus on health equity in this webinar is deliberate. This webinar brings together scientists, community leaders, and others. To help us achieve the objectives of this webinar, this collaboration is really focused on better understanding the impact of the COVID-19 pandemic and health equity issues affecting children and adolescents and their families in Canada and the United States, and also sharing successes and lessons learned, identifying barriers to multidisciplinary research with and about children, adolescents, and families within a pandemic context, particularly for diverse and underserved communities. Our agenda for today is really focused on the next steps. What can we do to further promote the health and health equity of and for children, youth, and families? So I'll now pass the mic to my colleague, Dr. Diana Bianchi. Over to you, Diana.
Thank you so much, Christine. I'm the director of the Eunice Shriver National Institute of Child Health and Human Development. And on behalf of our institute known as NICHD, we would like to welcome you to this joint webinar that we're co-hosting with our colleagues at the Institute of Human Development, Child and Youth Health, IHD-CYH, which will be referred to as ITSE, which is coming to you from Nova Scotia, Canada. I'd like to begin my remarks with an acknowledgement that we honor all of the ancestral stewards of the land in the United States of America on which we meet today, and their descendants who are living in 1,000 tribes, nations, bands, pueblos, and communities or native villages. NICHD, which is part of the 27 institutes of NIH more broadly, is located in Bethesda, Maryland, the traditional territory of many Indigenous nations, including the Nacotchtank, Anacostan, and Piscataway tribes. I'm actually coming to you from my permanent home in Massachusetts on Cape Cod, which is the traditional territory of the Wampanoag tribe. And I literally live less than half a mile away from First Encounter Beach, which is where the Pilgrims first met the Wampanoags. We recognize the enduring presence and resilience of Indigenous peoples in this area and we're grateful to share their land and their resources. At NIH, as a research organization, we're committed to addressing public health priorities and inequities in our diverse communities through the research we fund and the policies and processes that we enact. We'll work expeditiously to remove barriers and to increase needed investments, always listening carefully to diverse voices from communities in the United States and around the globe. The unprecedented challenges of the COVID-19 pandemic compelled all of us to identify how can we be most effective in intervening to protect and promote the health of the members of our most vulnerable communities. Today, you will hear from NIH-funded researchers and community members who work and reside with children and families in diverse communities that experienced significant hardship during the pandemic that led to adverse outcomes for some, but also gave us examples of resilience for others across some settings. At NICHD, the year before the onset of the pandemic, we had launched our new mission and vision statements as part of our new strategic plan. Our vision at NICHD is to promote healthy pregnancies, healthy children, healthy and optimal lives. Our mission is to lead research and training to understand human development, improve reproductive health, enhance the lives of children and adolescents, and optimize abilities for all. We've also placed an emphasis on 5 cross-cutting scientific areas across research priorities identified in our Institute on Global Health, Health Disparities, Infectious Diseases, Nutrition, and Prevention, all of which are very relevant to our discussion today. In today's webinar, we look forward to learning about new insights as they related to the impact of the COVID-19 pandemic on children and families in Canada and the United States that have been revealed by research supported by our mutual organizations. We're also particularly humbled to hear today from several community members from communities that were particularly hard hit by the COVID pandemic in both Canada and the US, and we're particularly interested in their lived experiences during this difficult time. I would now like to introduce our co-moderators for today's webinar, Dr. Ruth Wari, who is the Associate Director at ITSE, and Dr. Vesna Kutlesik, who is the Director of the Office of Global Health at NICHD, and they've come on screen now. And I'd like to extend a special thanks to Joanne Wincentak at ITSE and Dr. Janelle Walker at NICHD for serving as members of the Planning Committee for today's webinar.